Imagine this: two of the most common health challenges, diabetes and high blood pressure, working together in ways that can silently affect your body. What if you knew how to manage both in a way that would give you the freedom to lead a healthier life? In today's video, we're diving into the critical connection between diabetes and blood pressure. Diabetes affects how your body processes glucose, and high blood pressure or hypertension puts added stress on your heart and blood vessels. When these two conditions come together, they can create serious health risks if left unchecked. But here's the good news. By understanding their relationship, you can take control of your health. Because by the end of this video, you'll have valuable insights into managing these conditions effectively. We'll cover how diabetes impacts blood pressure and vice versa, and what you can do today to make a difference. Remember, it's all about awareness and taking action for a better, healthier future. So stick around as we unravel the complexities of these interconnected health challenges and empower you with knowledge for better health management. Let's start with diabetes. What comes to mind when you think of it? Diabetes is a chronic condition, and it changes how your body manages blood sugar. Imagine your body as a machine. When working right, it keeps everything balanced. But in diabetes, that balance is disrupted. There are two main types: type 1 diabetes, where the body doesn't produce insulin, and type 2 diabetes, where the body struggles with insulin resistance, often due to lifestyle factors. When you think about diabetes, notice the common symptoms like thirst, frequent urination, fatigue, and blurred vision. You may also wonder what puts someone at risk. Factors like obesity, family history, or even a sedentary lifestyle play a role. Remember, diabetes doesn't just affect blood sugar. It's linked to heart disease, kidney damage, and nerve issues. But here's the empowering part. Understanding these risks allows you to take action, because the more you know about the symptoms and risks, the easier it becomes to manage them. With a good plan, you can reduce complications and live with greater freedom. Now let's talk about blood pressure. What exactly is it? Blood pressure is the force of blood against your artery walls, and it's measured with two numbers, systolic and diastolic. When your blood pressure is normal, you hardly notice it. But when it's too high, it starts causing problems like heart disease or stroke. And if it's too low, it can make you feel dizzy or lightheaded. Imagine blood pressure as the pressure in a garden hose. If the hose is clear and open, the water flows easily. But if there's a block or the pressure is too high, that's when damage can occur. Regular monitoring is crucial because high blood pressure often has no symptoms. It's a silent force. By keeping an eye on it, you can catch any issues early and prevent complications. Notice how a simple action like monitoring can give you the freedom to act before problems arise. Here's where things get interesting. Diabetes and high blood pressure don't exist in isolation. What many people don't realize is how closely connected they are. When blood sugar is high, it damages blood vessels and nerves, increasing resistance in your arteries. This often leads to hypertension. Studies show that almost half of people with diabetes also have high blood pressure. Imagine the strain on your body when both conditions are at play. But there's hope. When you manage diabetes effectively, keeping blood sugar stable through diet, exercise, and medication, it can reduce strain on your blood vessels, lowering blood pressure, and vice versa. Controlling blood pressure helps prevent diabetic complications like heart disease. Remember this connection. It highlights why managing both conditions is essential for long-term health. You have the power to take control by adopting a holistic approach, ensuring you address both diabetes and blood pressure simultaneously. So, what can you do? Managing both conditions involves informed lifestyle choices, and you can start with your diet. Imagine how you feel after eating whole, nutritious foods like lean proteins, fruits, vegetables, and whole grains. These foods not only help control blood sugar, but also lower blood pressure. Reducing sodium and avoiding processed foods gives you the freedom to maintain stable health. Exercise is another key factor. When you commit to regular physical activity, you improve insulin sensitivity and lower blood pressure. Aim for 150 minutes of moderate exercise each week, and notice how it helps keep both conditions in check. Remember, every small step you take adds up. Lastly, don't underestimate the power of regular monitoring. Keep track of both your blood sugar and blood pressure. When you do this consistently, it allows you to adjust your management plan and stay ahead of potential complications. It's about giving yourself the freedom to live without the weight of uncertainty. As we wrap up, let's remember what we've discussed today. The relationship between diabetes and blood pressure is critical, but with the right knowledge, you can take charge of your health. Imagine living with more confidence and freedom, knowing you are managing these conditions effectively. By making smart dietary choices, exercising regularly, and monitoring both blood sugar and blood pressure, you can significantly improve your health outcomes. When you take these steps, you give yourself the gift of long-term wellness. So, if this information has been helpful, please subscribe to our channel, like this video, and share it with others. Together, we can empower more people to make informed health decisions and enjoy the freedom of better health. Thank you for watching.